Good evening, everyone. Thank you very much for joining us on this public talk titled Snoring. Is it actually an annoyance or is it a silent killer? And during the process of this talk, we'll be also answering certain questions. As I'm going to present my talk, you'd be free to ask any questions that you may like, or interrupt me in between so that I can answer your questions. So without any further delay, let me talk to you and introduce you to, is snoring a silent killer or is it just an annoyance? So for us to deeply go into this particular topic, it is important that we understand what is sleep. Sleep is something which is very, very essential for every living being. Let it be an animal or let it be a human being. Sleep is something that restores our well-being. Now, since snoring is something that happens in sleep, and since we want to talk about the ill effects of snoring, that is why we are talking about what is called as sleep first. Now, sleep means different things to different people. Sleep to you may be something like sleeping in a big warm bed with a lot of comforters and big pillows. But it means the same to this Sadhu Maharaj who is actually sleeping in the tree, and that is comfortable for him and he gets sleep there. If you look at the actual definition of sleep, sleep is actually a reversible behavioral state. Now, it is as important as a person being awake. And by definition, it involves disengagement from and a substantial decrease in responsiveness to the environment. And the perfect example for this is when you take your child to a movie, no matter what is going on the screen or no matter how much music is blasting through those Dolby stereo speakers, the child is very happily sleeping. And that is what is sleep. And that is what everybody as an adult want to achieve. Now, good sleep hygiene is something which is very critical for one's overall physical and mental health, because if one sleeps well, only then the person can actually perform well in the next day. Normally, for all human beings, it would take anywhere between 10 to 15 minutes to fall off into sleep once you hit the bed. But if you are somebody or you know somebody who's asleep within 5 minutes of going into sleep, or you're talking to a person and the opposite person just falls off into sleep within 5 minutes, this is called an excessive sleep disorder. Now, there are many kinds of sleep disorders, of which obstructive sleep apnea, for which snoring is a main symptom of, is one of the commonest causes. Now, sleep is not a single stage. Sleep is actually different stages of sleep, like a step well, as you can see in this particular slide. Now, there are basically this slide is a little older slide. The newer slides basically tell us that there are only 3 stages of sleep. Now, each stage represents a different comfort level for the brain. Now, stage 1 sleep is a situation where a person goes into sleep, but all his parameters in terms of his heart rate, his respiratory rate, those slowly start going down and the person is achieving a slightly state of relaxation. Now, once from the person going from stage 1, he goes into stage 2, is where every human being goes into what we call as a restful sleep. Most adult human beings sleep at stage 2, and that is what we want to achieve. Now, stage 3 is a stage where most children, they have their sleep in, and as a person or a human being grows older, their level or a capacity to reach stage 3 sleep goes off. Now, if these 3 stages are stages of what we call as non-dream sleep, which most human beings stay in, there is what is called as a dream sleep as well, where most of us actually have our dreams. But even though it's called dream sleep, the body is very active. And fortunately, the body is in the physical activity of the body, that means the hands, the legs, they are all in a semi-paralyzed state. You'll be very surprised to understand that. Now, why does the body do that? Because in dream sleep, if your body doesn't relax to that particular level or gets a semi-paralyzed at that level, if you're having a very bad dream as to somebody is chasing you, or you're having a very scary, horrific dream, if your legs and hands are active, you might actually hurt the person next to you. And that is a safety switch for the body, that when you are in dreams and when you are having your lucid dreams, your hands and legs are semi-paralyzed. And now this dream sleep is also very, very important. Now, it is a combination of these 3 stages during non-dream sleep and the dream sleep complete one single cycle. And every human being goes through such cycles during their entire night, depending upon their duration of sleep. And when you have these sleeps as 90-minute cycles and you have multiple of them, and the longer you have, the better quality of sleep you are basically having. Now, at this point, I would also like to introduce you what is called as sleep hygiene. Now, lot of us during this time do not give enough time for having rest. And we tend to do all kinds of things. Since we don't sleep well in the night, we tend to take daytime naps. We also sit with our friends and colleagues having a lot of caffeine and nicotine. We also have this habit of drinking alcohol before going to bed with the false pretext that alcohol will give you better quality of sleep. On the contrary, it makes your sleep worse, and I'm going to talk to you about how it can make your sleep worse. And also, to go to bed hungry or to eat late and then go to sleep very late, that's also very bad. Most of us Indians are also addicted to having very offensive foods, like very spicy food later in the night at 11 o'clock, 12 o'clock, and then hitting the bed. Even drinking a glass of orange juice, which is filled with acids, can be bad if you have very late night juice and then go to sleep. Now, if these are things that you don't want to be doing, what are the things that are good for you? One, and the most important thing, is to establish a regular bedtime. That means if you're somebody who's used to sleeping at 11 o'clock, sleep at 11 o'clock. And try to exercise mostly early hours of the day or late afternoon if you are somebody who works in a shift. Take a hot bath a couple of hours before go to sleep, and this you don't need a doctor like me to tell you, even your grandmother will tell you that. Establish a comfortable sleep environment. That means have a nice cozy bed. Have whatever is comfortable for you. You don't even have to have a water bed or whatever, the best of the quality of beds. Whatever is comfortable for you. If you are somebody who feels very comfortable sleeping on a mat, that is what you should do. Sleep in a dark, quiet room. Let not your spouse watch TV while you are going to sleep. If that is what it is, you please move out of that room. And the most important thing is to establish a relaxing pre-sleep routine. Get into nice light clothes. Like I said, also have a shower, and then try to read something like an editorial, not some kind of a novel which is putting your nerves to test. And these are some things that most of us do or don't do, and hence affects the quality of our sleep. So what are the effects of quality of sleep? Please go through this small video. So lack of sleep actually causes a lot of side effects. So, slower reaction time, loss of motivation, reduced decision making skills, poor memory, and all of these, when you have poor night sleep, the next day, this is what happens to you. And this is something which shouldn't be done, and you should be taking it seriously if you have any of these symptoms. Now coming to the topic, what is snoring and sleep apnea? Now, snoring is a sound generated by partial airway obstruction. Now let it be a baby who's 6 months old or a grandfather who's 85 years old. If somebody is snoring, that means that particular individual is not able to breathe properly. That means there is a partial airway obstruction. Now, if this partial airway obstruction swings into complete obstruction, that is called sleep apnea. That means an absolute blockage of air at the nose and mouth. That means there is no air going through the nose and mouth for about a minute or so. That's called sleep apnea. Now, let's just play this particular video for you. Take a look at this guy who's not very fat and he's trying to sleep, and see how he's desperately breathing very hard and he's still not able to get air into his lungs. This, my dear colleagues and friends, is called sleep apnea. If you have somebody, your friends, your relatives, your brothers, your cousins, who have this kind of a behavior when they go to sleep, they do need medical attention. So what is happening here? Let me just now, when a person is awake, air should be going through the nose, crossing the palate and behind the tongue base, which constitutes the airway, and the air keeps going down with ease into the lungs. But for some reason, if the air is going very turbulently, it causes a partial airway obstruction, causing the palate to vibrate, causing snoring. Now, by some reason, if this obstruction becomes more, that means if there is absolute blockage of airway at the palate and tongue, that is called apnea. Now, why are we even discussing this? Because WHO actually called this condition the disease of the 21st century. Why? Because this is one condition which is associated with this myriad of other diseases, namely hypertension, having diabetes, congestive cardiac failure, and obesity, drug-resistant hypertension. When we say drug-resistant hypertension, I'll give you a simple example. If there is somebody who's requiring more than 2 drugs to control their hypertension, that is to tell us that probably something else sinister like obstructive sleep apnea is at play. And there is a 91% incidence of nighttime heart attacks among patients who are suffering from snoring and sleep apnea. So, obstructive sleep apnea, because of the diseases that it is associated with, is one of the most important conditions identified in the last 50 years. So, how is this measured? It is measured by a metric of measure called apnea and hypopnea. Apnea means there is an absolute blockage, and if there is a 50% blockage for the free flow of air, it is called hypopnea. So, if somebody is not able to breathe for about 10 seconds at a time, that amounts to apnea, one single apnea, and depending upon how many times they are choking per night, then they are given a particular score called apnea index or hypopnea index. Many spend half their time in their sleep with total airway obstruction. If you really look at the prevalence of India, it is about 7.5% in men and 4.5%. If you really closely look at this particular demographic description, even in countries where like the United States or Australia for that matter, the number is much less than it is in India. Even in countries like China and Korea, wherein there is a mongoloid phase and it is supposed to be causing what is called as skeletal overloading, even their incidence is less than their incidence in India. And there are many reasons why India steals the cake for all the bad reasons for the prevalence of obstructive sleep apnea. Recently, in 2019, there has been an article which is published by Lancet, which is a very, very reputed journal, wherein they spoke about the global burden of obstructive sleep apnea. How much is the global burden? And they estimated that there is a staggering 1 billion adult populations between the age of 30 to 69 worldwide that could be having obstructive sleep apnea. And the number of people with moderate to severe sleep apnea, that means the people who are choking about 30 times an hour, for which treatment is generally recommended, is a whopping 425 million. And that is the kind of number we are really looking at. So the economic burden, which has been published by the American Academy of Sleep Medicine, only in the US is about $150 billion per year. That is, in Indian rupees, I can't even read the number of zeros that are there. That is the number of, that is 149.6 billion US dollars in Indian rupees. That is the economic impact. So these are the, and 7.5% of our population is actually having this particular condition, and that's why I brought this slide back. So epidemiological studies from India suggest that the prevalence of OSA is similar to that of US whites despite the lower level of obesity. So if you really look at the obesity levels in Indians and in US, among US whites, our obesity level is much less, but still our prevalence of obstructive sleep apnea is very high. Young et al. Reported on the differences of prevalence of obstructive sleep apnea in severely obese South Asians and whites in a UK bariatric clinic, where all patients underwent limited channel hope study, sleep study, and they found that OSA among South Asians is significantly higher. South Asians, when I am talking about South Asians, I am also taking Pakistanis, Bangladeshis, and Sri Lankans, including Indians, have a higher prevalence than whites and a subsequently greater apneic hypopneic index, which I said is the metric of measure of the severity of sleep apnea. Now this is how our typical Indian looks like. We are not obese at the top to bottom like how other Caucasians are. We are all people who are having central obesity. So even though our totally BMI is very less, since our central obesity is very high, we are more vulnerable to conditions like metabolic X, diabetes, so on and so forth. So it is a well-known fact that South Asians manifest lot of visceral adiposity and hence insulin resistance. South Asians commonly develop various metabolic adverse metabolic profiles, and clinicians need to understand the use of the term one size doesn't fit all BMI. For example, if you use the same BMI to call a Caucasian obese and an Indian obese, we would fall back in terms of the number. But since we are big in the center, since our central obesity is higher, our propensity to develop conditions like obstructive sleep apnea is higher. Also, when you look at anthropometric measures, especially among Indians and especially in the South, and this is a severity of OSA study that we did based on Hyderabad population, we found out that significantly there are increased numbers in the age group of about, as you can see in this basic chart, that higher incidence of obstructive sleep apnea. Weight wise also, you see they are not very fat, they are just in the overweight category or normal weight category, yet having severe obstructive sleep apnea. So we need to understand that we as Indians and South Asians have certain anthropometric measures, like you will not be able to pass 4 fingers between the thyroid cartilage and the tip of your chin. We call this reduced thyromental distance. And also for most of us, the angle between the thyroid cartilage and the chin, we call it thyromental angle, is also very obtuse. And these are certain craniofacial features which already make one more vulnerable to obstructive sleep apnea. So even if you have a little bit of weight, that makes it worse. And we found that Asians have higher thyromental distance and thyromental angle. That tends to, and that's exactly what I was trying to explain to you in the earlier picture. And this is a picture that's and the graph basically trying to show the same thing. So when do you suspect as somebody is having obstructive sleep apnea? If you're a male, you're already in a high risk of having obstructive sleep apnea. And as you grow older, your chances of developing obstructive sleep apnea is higher. But that doesn't mean youngsters don't get it. It is a condition that can affect any age, even a child of 6 months. Increased waist to hip ratio. This is the metric of measure that we need to use for Indians because of our central obesity. If you are a smoker and if you are somebody who has a small maxilla and small mandible, what we call as skeletal overloading, you are already having an increased propensity to develop sleep apnea. And needless to say, if you are having thyroid issues or somebody who is having growth hormone issues, you are probably having narrowing at the upper airway causing obstructive sleep apnea. Now the obstructions that are there for the free flow of air can be of 2 kinds. So for somebody having obstructive sleep apnea, they have a combination of physical obstacles to the free flow of air, or their airway is so lax that it basically is collapsing. For example, let me show examples of what we call as static obstructions. This particular individual is having a ball-like lesion preventing the airflow going into the airway. That is the windpipe, and this ball is causing an obstruction. This particular person could have a problem. Similarly, if you see in the video on your left side, there is a tissue behind the nose called adenoid, which is something that most kids and people with acidity, people with reflux can have, causing an obstruction to the free flow of air. Now these are called static obstructions. Now these are obstructions that are there for a human being when they are awake or asleep, as opposed to obstructions like this, wherein you are seeing a leaf-like structure above the upper airway which is getting blocked with every inspiration. And this is something that is happening to an individual only during the person's sleep. And this is a study called drug-induced sleep endoscopy. For somebody who's having obstructive sleep apnea, it is not usually the individual himself that comes to the doctor to take advice for his basic problem. It is usually the spouse or the sleeping partner complaining about the snoring that the bed partner is actually doing, or they are terrified by the fact, like how I showed in the video before, that there is significant obstruction and the person is struggling to breathe, which we call witnessed apnea. And this is what has alarmed the sleeping partner to bring the spouse to the doctor. Now, there are various symptoms through which obstructive sleep apnea presents, if these on the left side are all the nocturnal symptoms, this patient himself may present with symptoms like just a simple early morning headache. If somebody who's getting up with early morning headache every day, or a person is saying I'm fatigued throughout the day, or my memory is gone down, I'm feeling very depressed, it is sleep apnea which is causing the problem. So a good clinical history, assessment of the obesity, a thorough ENT exam, like I showed you, all obstructions in the upper airway have to be assessed, assessment of a thyroid profile, and a good, what we call as a sleep study. Polysomnography, also called as a sleep study, is the gold standard tool through which you can measure the severity of this condition. Now, why should we treat this condition? For every person, right, there is a person who actually may be a CEO of a company, or somebody who's holding a very important post in the government. If he is somebody who's waking up every day in the morning and falling off to sleep when he's driving to work, or who's somebody who's unable to take proper decisions in time, that is one indication that you need to treat the sleep apnea. Now, there are other patients who come to us with drug-resistant hypertension, or somebody whose diabetes is not coming under control, or for somebody who's having a social factor that, doctor, I just stopped traveling in trains because if I sleep, the rest of the train passengers are waking me up and that is causing me a problem. These are the different complaints with which patients actually come for the treatment of sleep apnea. And I've already discussed the gravity of the problem of OSA with cardiovascular system. And so I also spoke to you about obstructive sleep apnea and diabetes. And impaired glucose tolerance is a big problem when you want to control diabetes with obstructive sleep apnea. So how do we go about treating this condition? Once we do a sleep study and assess the severity of the problem, this is another very easy way of doing it. You can either do this or this, but there are different kinds of patients. Like I said, one size doesn't fit all. Different patients require different ways and means of testing it. So we do what is called as a sleep endoscopy to assess the behavior of the upper airway during sleep, and we sort of see how the person is. See, as you can see here, the person is asleep, and you can see that the airway is completely getting blocked as the person is going to sleep. And then once these kind of efforts are there to breathe, you will shortly see the airway. So now you can see that this is at the level of the palate, and the person is actually snoring, which you can witness in the form of a vibration that's basically happening there. And this obstruction is happening at that level. Based on the pattern of collapse, the structure causing the obstruction, and the severity of the obstruction, we go about treating these obstructions either by using a machine called CPAP machine, which basically means continuous positive airway pressure, which sends in a blast of air which opens up the airway. There are certain patients who will not use the CPAP or are not able to use the CPAP for various reasons, and in such patients we do a surgical intervention to clear off these obstructions. So there are many treatment options. Like I said, this is CPAP. This is a person in rural India using the CPAP machine. Some patients are unable to use CPAP machines for various reasons, and in such conditions we use surgical interventions, whether they may be soft tissue or bony interventions. The future is about putting implants wherein a person breathes, and every time he breathes, his airway would open by putting up this kind of implant. This implant is actually already available in the US and in Europe. In India, it may be shortly be available. And weight loss is something which is also very important for the success of OSA treatment. And thank you very much for hearing me, and I'll be happy to take any questions if there are any.
There are few questions. Patient Rajesh from Nagpur, he is 44-year-old male. He is complaining of morning headaches whenever he gets up in the morning, and he feels drowsy while driving, and during the speed breakers he sleeps. Could it be related to sleep apnea?
Yes, like I said, this is one of the commonest causes of presentation for obstructive sleep apnea. For example, the very fact that the person is waking up early morning every day and he is not fresh and he's heavy-headed and having sleep and getting excessive daytime sleepiness, especially when he is driving, that is actually a very scary symptom, and this can be obstructive sleep apnea, and he needs to meet his pulmonologist, his general physician or an ENT to evaluate this condition.
Yeah, there is one more patient, sir, like Reshma from Kolkata. She complains that her husband, he snorts loud in the night and he stops breath for few seconds, and she feels very tensed and she wakes him up from the bed. How to manage this, and could it be sleep apnea?
So that's a very good question, and one of the commonest presentations for the management in sleep apnea presentation. Now, the first thing that he needs to be looked at is the person choking only when the patient is on the back, or does he choke when he's on the side or no? Number one. Number two, what is also important and needs to be seen is that is he choking, to what extent? Is he waking up or no? This condition is obstructive sleep apnea, especially when he is not waking up fresh in the morning. This needs evaluation and management. And thankfully, once you identify the problem, the treatment is very easy, and the husband and the wife can sleep later comfortably once this treatment is done.
There is one more question, sir. Mr. Shekhar, he is complaining he is having a severe nose block. He visited some ENT doctor. They told that clearing a nasal obstruction my snoring will clear. Like they said that clearing the nose, the sleep apnea will come down. So is this the solution for my snoring? Clearing the nose?
Very good question actually. A lot of people think that clearing the nose would clear off their snoring. They are actually very mistaken. Snoring is neither generated at the nose or is because of the nose. Snoring is because of two currents of air going from the nose and through the mouth. So this current, one current of air going through the nose and one current of air going through the mouth, causing fluttering of the soft palate, and hence obstructions at the level of the soft palate and vibration at the level of the soft palate is what is causing the snoring. So clearing the nose may allow the patient to have good quality of sleep, but it will not clear the snoring. That's a mistake that most of us do, but snoring is neither generated at the nose or is because of the nose.
So one more question, what are the long-term complications of having sleep apnea if it is untreated?
So complications of sleep apnea are very many. It's a condition that can affect a lot of systems, right from the respiratory system to the cardiovascular system to the endocrine system. Now, all of these problems are reversible. That's the important thing. If there is somebody who's having drug-resistant hypertension, if somebody whose heart is beating causing arrhythmias, and if there is no other cause which is found out by the one of the commonest causes for it is sleep apnea. So not treating sleep apnea is not an option, especially because this is something that can be cleared and can be controlled. So because this condition is associated with all these conditions, like the WHO said, this is one of the most important diseases of the 21st century. Clearing it, identify what again needs to be understood is, one, we need to do a repeat sleep study and compare it with what is the result. So one is an objective way of measuring our success, second is a subjective way of measuring success. He has already said that there is no result. Now we need to look at it from a objective way also. Repeating the sleep study, which will tell us the severity, the impact that this condition is still having on this individual post the treatment, number one. So when you compare the new sleep study and the old sleep study, we will be able to decide how much disease has either deteriorated, remained status quo, or gotten better. Number one. Number two, we also need to do what is called as a drug-induced sleep endoscopy once the sleep study is done to identify the severity of the airway. That means how much and where is the airway collapsing. And if there is an earlier drug-induced sleep endoscopy, we can compare with both of them and see where was the earlier collapse and where is the collapse now. What is also very important we need to understand is obstructive sleep apnea is a progressive disease. If a person is putting on weight or has become complacent to the fact that he is not able to maintain a good lifestyle, obviously that also will impact the success of the treatment. Because treatment is offered at one point, but the disease had chance to move in its progress. So we need to also look at it in that way.
Thank you, sir.
Thank you.
So one more question, sir. Is all the snoring patients will have sleep apnea?
Not necessarily. Now, there is a condition called primary snoring, wherein a person is only breathing heavy. That means the person is having snoring, but is not having any impact in terms of the fact that the air is going in. That means the lung is able to pull the airway, the oxygen is being maintained in the air, in the body, but there is a lot of snoring. Not all snorers are sleep apneics, but most or every sleep apneic is a snorer.
Thank you. So one more question is already asked. How to evaluate what type of sleep study should be done for OSA?
Right. So that's a very general question. Now sleep studies come in four kinds. Depending upon the patient's needs and depending upon the diseases that are associated with the person, we decide between level 1 and level 4. Level 1 is, see, whenever you assess sleep apnea, right, you have to assess multiple things. You need to assess the stage of sleep, the depth of sleep, the posture at which, the position at which the person is having apneas, that means inability to breathe, the stage of sleep at which these things are happening, and are there any other conditions that are associated with this. For example, a condition called periodic limb movement disorder, wherein a person's legs are moving. So all of these have to be measured. So in order to measure all these things, you need to do what is called as a polysomnography, and in short it is called a sleep study. Poly means multiple, somno means sleep, graphy means measurement. So these types of polysomnography based on the person's needs. So if there is somebody who's having fits and is on medication for fits, person is having congestive cardiac failure, and you as a clinician are suspecting sleep apnea, it is better to do a level 1 sleep study, which is a sleep study done in a controlled environment in a hospital. Now if there is somebody who's having uncontrolled hypertension or a condition like a COPD, which is a lung condition, you can do the same parameters which is done in the lab, in the hospital, at home. This is called a level 2. Now if there is somebody who is a 25-year-old or 30-year-old who has no other disease associations, who is not on any drugs, or he is not on any kind of medications for their problems, you can do what is called as a level 3 sleep study, which is basically a position cardiorespiratory measurement. If you are doing a study to find out the incidence of sleep apnea in a population group, supposing in your office or in your class or in your anywhere in a group of, to screen patients if they have obstructive sleep apnea, then you do a level 4 study, which is just a screening tool.
Thank you, sir. This is one more question from the same 14.
Okay, so in that we need to analyze other things. We need to understand whether, like I said, the severity of the disease is a combination of apnea and hypopnea. Apnea means absolute blockage and hypopnea means partial blockage. So you need to again dissect that value of AHI and see preoperative, is the apneas more and what is the apneas today. What is the apneas then and what are the hypopneas then, what are the hypopneas today? That is number one. Number two, you should also look at a metric of measure called oxygen desaturation index. That means the number of times the oxygen is falling by 3%. That also has to be measured, and if that is also showing that there is an increase in the disease, that then we have to really go back and see what went wrong for this patient, do a drug induced sleep endoscopy, and then see what are the structural causes of this particular or why the particular treatment has, I won't call it a failure, it basically says that the disease burden has basically not gone down. So it needs a thorough evaluation and assessment.
Yes, thank you, sir.
Right?
Yeah.
So thank you very much for joining us for this interactive session, and I would like to thank all the public who have basically interacted with us and asked those questions, and thank you for spending your time with us. Thank you.